Hey, welcome everybody to this podcast discussing how physical therapy can help folks with jaw pain, teeth grinding, and TMJ dysfunction. My name is Dr. Maegen Brady DeLeo. I am a doctor of physical therapy, board certified specialist in orthopedic physical therapy, and I own Union Square PT in Somerville, Massachusetts. In addition to practicing with my physical therapy world, I also practice and teach yoga at B and Union Yoga right upstairs. And this podcast that's geared towards patients and direct to consumers is in preparation for a lecture I'll be giving this upcoming week to the residents at Boston University and Boston Medical Center in the dental and medical world. The objectives of this discussion are so that you can learn the implications and applications of physical therapy for folks with jaw pain. So how can physical therapy really help you? We'll also get to observe some live action video recordings of dry needling, which are available on YouTube and Instagram, so you can see firsthand some of the modalities that can help with jaw pain. And after watching this video, stick to the end because there's a special offer to participate in a complimentary 20-minute full body diagnostic with me at Union Square PT or over the phone, telehealth, so that we can really help make the best recommendations for you and decreasing the jaw pain that you might be experiencing. I have no financial disclosures for this discussion. There are a couple of materials that I may recommend, but no relationships or endorsements. When we talk about the anatomy of the temporomandibular joint, the TMJ, it's a tiny ball and socket joint. So the ball of our jaw, our mandible, sets in the socket joint of the temporal or outside aspect of our cranium, our head. There is a very small discoid cartilage that acts as a cushion between that ball and socket joint to help protect the joint. And for some folks, this joint can become malaligned for various reasons. And that can include trauma, surgery, other malformations. And I can tell you anecdotally from my own practice, one of the most common reasons that folks experience jaw pain is muscle tension and strain that causes an imbalance around the joint. And for all of these reasons, physical therapy can help to collaborate with you, with your dentist, and the rest of your medical team. And that's what I'll be discussing with the residents this upcoming week, how we can really be your team and all work together collaboratively. There are many muscles around the temporomandibular joint that we would take a look at to assess how we can really help reduce tension in these areas. There is the very strong chewing masseter muscles. So if you've ever seen someone that plays the trumpet, you would notice very well developed masseter muscles. There are muscles that surround the joint area. There are muscles that connect down to the front of our collarbone and breastbone, and muscles that also connect to the sides and back portion of our neck and shoulder blades. So in this instance, everything really is connected, and we'll be looking at a holistic whole body picture to really help reduce strain in this one specific area that's connected to so many other areas. So dentists and medical doctors can refer patients to physical therapy. In the state of Massachusetts, if you're experiencing jaw pain and teeth grinding and discomfort around your TMJ, we have a law called direct access. So you could go right to your physical therapist so that they could do a full body diagnostic evaluation with you to assess how they can best help with you. As a doctor of physical therapy, I've been trained in screening out for other red flags. So if it's not something we can help with, then we can refer you to a doctor or a dentist. And many times we do really like to collaborate in this team approach. So a couple of different ways to get help with physical therapy by either going directly through direct access or getting a referral from your dentist or doctor. If the muscular imbalance is a cause of dysfunction, or if you've had surgery, physical therapy can really help. And ideally, working with someone with a specialization in orthopedics, so sports injuries, the musculoskeletal system, and someone who's had advanced training and practice working with folks with TMJ dysfunction can really be helpful. It's vital to really have the time and space to work with your physical therapist. So make sure it's someone that can work with you one-on-one, that will give you some space and some privacy so that you can discuss all of your concerns and really give you the time to be able to go through the different stages of the program that will really empower you to work at home. What can you expect from your first physical therapy treatment session for jaw pain? We're going to do a full body evaluation. And first, we're going to sit down and do some history. So there may be some paperwork, but I definitely want to talk with you one-on-one to find out a little bit about what's been going on. What's the chief complaint? What's the thing that's been bothering you the most? And how long has this been going on for? Was there an event that started with this, or did it just happen over time? What makes it worse? What makes it better? Do you experience teeth grinding or tension either during the day, or have you discovered that you grind your teeth at night? I want to know about your background and your lifestyle, sleeping, nutrition, stress management, your activities, and your work, because all of these facets really make up who you are as an individual and can help us make the treatment to work with your jaw pain as individualized and personalized as possible. I'll be discussing with the residents this upcoming week a case study that I've shared with Dr. Andrew Henry. He operates out of Boston Medical Center and teaches at Boston University. So we've shared a patient who's a 22-year-old female, and she had surgery on both sides of her jaw to take out some scar tissue that was caused by a trauma. She experienced the inability to open her mouth fully and had stiffness around her neck and her spine. She came to physical therapy 7 weeks post-op so that we could work on joint mobility and normal head movement. It was one of her goals to be able to eat sushi again, to be able to open her mouth up enough to enjoy some of her favorite foods. And including activities, she studies at Berkeley, which is a revered college of music and fine arts, where she specializes in piano and singing. So these were all of these kind of activities wrapped around her goals of being more active and more confident. So we'll discuss this patient throughout our discussion today. As you prepare to come in for your first treatment session, you can expect that we're going to take a look at posture and mobility. So even while you're sitting in the chair, I'll be observing. How are you sitting? Do you tend to cross your legs, fold your arms, lean to one side, or tilt your head? These are all common postures and practices that we might not even be aware that we're doing throughout the course of the day, but your physical therapist may be able to give you some tips and tricks to be aware of these postures as you're sitting during your work or school day. We're going to now stand up, and we'll take a look at posture in standing. I want to look at the alignment of your spine from the front, and we're actually going to begin at the ground up. I'll look at the position of your feet, your knees, your hips, because this foundation can align the rest of your spine, your shoulders, your neck, and your jaw. So even though the site of pain may be up here, there are sometimes relations, and more often than not, relations to other areas of the body. After we look at your posture from the front, we'll look at your posture from the side to be able to observe, is the head sitting more far forward? Are the shoulders rounded? Is the jaw moving more in one direction or the other? And we'll look at this from both sides as well as from the back. What you can also expect to talk about with your physical therapist is the strength in your core, your abdominal muscles, and how flexible your hips and your legs are, because this can also feed into the upper body. Everything really is connected, and we take a full holistic view of the person. I'm also curious about breathing. and your speech pattern, because a lot of times the nose and the mouth play with breathing. Do you tend to breathe in through your mouth or your nose? Do you tend to breathe out through your mouth or your nose? So these are all aspects that we're taking a look at as we're investigating some more posture. Next, we're going to take a look at how you're moving. I want to see your upper spinal mobility. So taking a look at how the head moves down towards your chest. How are you able to look up towards the ceiling? Are there any deviations? Does the head move to either way as you're looking up or down? That may indicate some tightness or some muscle imbalance on one side. How is it to be able to turn your neck in one direction and then the other? And finally, how is it to tilt your head in one direction? It's gonna be a nice stretch on the side of the neck. And just determining if there are symmetries between the two sides here. I'll also take a look at more specific jaw motion. So how is opening the jaw? How is closing the jaw? Patient might identify if there's a click or a pop, if the jaw tends to deviate to one side or the other, and that may indicate which side we may want to work on more. Sometimes it's both, but a lot of times we may really need to focus on one side more than the other. I also want to take a look at shoulder mobility. So how is reaching your arms up overhead? How is it to take your hand behind your back? Or how is it to take your arm up above? Just to get a general idea of shoulder and mid-back mobility. And I'll even really look at the lower spinal motions, those same motions as the neck, the forwards, the back, the side to sides, the rotations, because getting a view of the whole spine and even just how your attitude to movement is, are these things that you might be afraid to do because they cause pain. How can we investigate those a little bit to help make them more confident? We'll take a look at how you walk, because that is also connected to the motions. I want to also see how your strength is. So we'll take a look at your grip strength and the strength of the muscles around the neck, the shoulders, the jaw, because strength and training these muscles around the area can also be a really key part of physical therapy. Next, you can expect for our first meeting, I'll get you on the table. I'll get you comfortable, lying on your back, with a pillow underneath your head and one underneath your knees. If there's any modifications that are required, we can also increase a little bit of wedge or cushioning to help elevate you here. I want you to be as comfortable as possible. This is where you'll be exploring. I'll be using my hands to kind of feel out how the muscles around the shoulders are, how are the muscles around the neck, and as we get closer towards the jaw and the ear. All the while, I'd love to chat with you about your goals and things that you like to do, where you live, who you live with, and how long you've been there. This just helps me give an idea of what your lifestyle is like and the things that you're looking to achieve. We'll get a little bit more specific and we'll start to feel and really investigate some of the muscles around the jaw and the back of the neck area here. And it can be very affirming to hear from a medical professional like, oh yeah, those muscles are tight. These are something that we can work on, and these are things that can get better. So knowing that you have a team and knowing that you have people that are advocating for you to improve and to empower you to do so can be very helpful. We'll also take a look at some of the muscles in the back body. If you're comfortable to lie flat on your stomach, it's really helpful to really feel those muscles in the upper neck area and in the base of the head region. And if able to lie on your side, I always like to look at how the mid-back is moving, how your ribs are moving, and all the while we're really just investigating these areas together by feeling them and also just getting started with some massage on day one. If we find a muscle that's tight, we can work on it right then and there, and patients can start to see improvements from the very first session. We're building a picture. It's like a puzzle. We don't always get the full picture on day one, but if we start to lay the pieces out and put more together, we start to see this picture that emerges time by time. The types of treatments that can be done in physical therapy, so what you can expect moving forward to really help you feel better. The massage and manual therapy is a really big part of what we can do. And not just massaging the muscles, but also mobilizing some of the joints. I'm really concerned as a physical therapist about how that socket, that ball and socket, how is that socket really sitting and accepting the jaw? So we may mobilize some of the muscles and joints in the upper spine to really produce that best position possible. I also offer instrument assisted soft tissue mobilization, and this training I've completed in the Graston technique is using different instruments that have different shapes, including some very small shapes, just to be able to kind of scrape and get a little bit deeper into some of the muscles around the area. This can feel really good to getting more blood flow to the region and getting a little bit deeper. Dry needling is something that I've alluded to earlier, and it's something we're going to delve into at this point in the talk a little bit more. But also just letting you know that the home program is going to be really important. A lot of patients find good relief with an electrical stimulation or a TENS unit for home pain relief, and that's something we can work on here in the clinic, and I can help you get set up with a company with a great reputation for electrical stimulation units. While they're available everywhere, the brand that I work with here has been fantastic for helping with pain. And I also really recommend to my patients doing self-massage using a foam roller, yoga tune-up balls, which are a little more forgiving than a tennis ball or a lacrosse ball, or even gua sha, which are these small rollers to use for the face. Dry needling, this is the modality that is the most effective and has been so helpful for so many of my patients with jaw pain. So we're going to spend a little bit of time now talking about the applicability for dry needling. So first, I'll ask you, have you heard of dry needling before? Have you ever had it? At this point, a lot of patients will ask me, they're like, well, is it like acupuncture? And I say, nope, it's completely different. The only thing similar between acupuncture and dry needling are the needles. They're very thin, small needles. Acupuncture, it's ancient Chinese medicine. They focus on the meridians, the energy lines of the body, where with dry needling, it's Western medicine, very specific to the muscles. So if you were like, Megan, this muscle right here or here is very tight, we're gonna target those exact areas. I'll ask you a couple questions just to make sure you're a good candidate for dry needling, including if you are allergic to chromium or nickel. Those are the metals inside of the needle. I'll also ask if you're getting any treatments for immune conditions. So if someone's actively undergoing chemotherapy for cancer or some other conditions like autoimmune rheumatoid arthritis or lupus, there's already so much blood flow inflammation processes going on in the body that dry needling and its application may just be too much at that point. I also ask patients if they have any implants like a pacemaker or artificial joints, because I want to be aware of just staying clear of some of these other areas. I'll ask patients if they've had any relevant surgeries to the area, and even though we've gone through the medical history at the beginning of our section, I'm always surprised what folks can remember and recall, and that is a big portion of our application of dry needling. And then I'll also ask patients if they're pregnant or have any bloodborne diseases, where these are special considerations for these individuals. I always take very specific precautions using clean hands and gloves and sterile equipment. We really want to be aware of where you're coming from so we can best serve you. There are a couple of videos I'll invite you to take a look at. YouTube.com @UnionSquarePT, and on Instagram and Facebook @UnionSquarePT, where we demonstrate some dry needling applications to patients in the back portion of the body, to the big upper trap muscles and the levator scapulae muscles that connect the neck to the shoulder. We also have a couple videos that demonstrate direct dry needling to the muscles around the jaw and how much it can really help improve blood flow. It causes a small micro trauma to the area to encourage blood flow to the region. And if the body's just been stuck and spinning its wheels, dry needling introduces a new stimulus to try to get the body to complete that inflammatory cycle and to move through the healing process. Sometimes, and quite often, we'll see or feel a palpable twitch when a homeostatic trigger point has been hit. And this is a release of tension from the muscles. Patients will notice it as well, and it's almost like an earthquake, a small little movement. And this is when I tell patients that massage can feel really good in the moment, but might not last for a long time. Dry needling doesn't always feel amazing in that moment, but it can produce longer lasting results. And techniques can vary. So the first time we're trying dry needling together, probably more of like an in and out procedure, or perhaps in and leaving it in for a minute or two just to bring that blood flow. But there are more advanced techniques, including rotational motions, pisting. We can use electrical stimulation with the dry needling. So for folks that have found good relief with our first session, these are advanced versions that we can also offer. And we just kind of start slow to go fast. Like, I've had a patient where we did one needle for the first session just to see how it felt. And she felt such good relief with that one needle that we continued to add on to between 5 and 10 is pretty typical for the first session. And we'll decide that number based on how irritable the symptoms are and your experience levels. It's great just to kind of get your experience with this. Now that we've really worked on some hands-on techniques, what you can expect from your first session in PT in terms of activities, exercises, and homework. So we're going to begin with the core. You can do this seated with your feet flat on the ground, sitting up nice and tall. Bring one hand to your belly and one hand to your low back. I recommend the palm of your hand on your belly and the back of your hand on your low back. This can also be done in standing, and typically we do it lying down with the knees bent. You don't have to put your hands here, but it may be helpful as we go through 5 pelvic tilts. As you inhale, feel your belly rise towards your hand, expanding outwards. And as you exhale, starting to press your belly button in towards your spine, feeling a little bit of a curve happening with the low back. We'll pause, and then again, inhale, sitting up tall, feeling your belly expand. On your exhale, feeling your belly button come towards your spine, towards the back of the chair. We'll do 3 more of these, demonstrating from the side here. On the inhale, the belly comes out. On the exhale, your low back starts to tilt back. So kind of like a slouch, but not slouching too much. I don't normally tell people to slouch. As we inhale, the pelvis rocks forward, and then as we exhale, the pelvis rocks backwards. If it's helpful, you can release your hands or put them on your hips for one more inhale in, and one more exhale out. Beautiful. Now that we began at the core, that's the key to everything. So everything up above the area and everything down below really begins with this core work. And we'll do 3 seconds on, 3 seconds off, 10 times, once a day, daily. However, it's great to do when you're just sitting in your chair at work or in your car. I like to also review with patients, now that we're getting up off the table, how to get out and out of bed. So we tend to sometimes kind of sit straight up and twist out of bed. I recommend bending your knees, rolling onto your side in the fetal position, and then pressing yourself up to seated by letting those legs drop down, using your hands to press up to a tall seated position. It's good to sit for a moment just to make sure the blood pressure settles, especially if you've done some dry needling. And I joke with my patients, I'm like, well, we do this every day. Even it's just twice a day, but this is something we do every day, getting in and out of bed. So really protecting your spine and your jaw as you use the momentum and use your body to press up, as opposed to straining muscles up and down. And I'll also talk a little bit more about sleep and how you're sleeping, the positions you're sleeping in. If you're sleeping on your side, I recommend a pillow between your knees to kind of help the back here. There are special pillows that you can use to kind of tuck under your arm. And I really recommend a cervical pillow. This is one that has a small divot in the middle that will help to cradle your head if you're lying on your back and support cushioning for your neck. And if you're lying on your side, it also has a really beautiful cushion underneath the side of the neck so that your head isn't tilting down or tilting up when you're sleeping. You have that nice straight alignment that can help you. Now, a lot of times folks with jaw pain will really benefit from a night guard, and this is really where that relationship between your physical therapist and your dentist will come in handy. Working with a dentist with experience with folks with TMJ disorder will be great because they'll be able to prescribe a custom fit mouth guard to help create a little bit of space between the teeth at night and prevent that grinding that we might not be conscious of when we are sleeping. So now that we've woken up and we've gotten out of bed, there are a couple of additional postural exercises that I'll go over with my patients, including standing. We'll stand with your back up against a wall. And if you're not able to stand, doing this seated and pretend like there is a wall behind you or perhaps the backrest of your chair. The heels don't need to touch the wall and the back of your head doesn't need to touch the wall. But as you breathe in, think about the crown of your head lengthening up towards the ceiling. And as you exhale, think about your shoulders dropping away from your spine. On the inhale, rooting through your feet and your pelvis. On the exhale, letting your chest open. We'll do one more deep breath in. And one more deep breath out, creating some space between your teeth, between your jaws, and resting. If you're in standing, you can stay in standing. This next motion can also be done sitting, where you're gonna pretend there's someone too close to you. They're talking too close. So, demonstrating from the side here, we're gonna back away from that person in front of us by tucking our chin back. So don't worry about the forwards part and don't worry about tilting the head back. It helps to have your eyes on steady spots in front of you. As you just tuck the chin back, it's a very small motion, 3 seconds on, 3 seconds off. Let's do like 3 more of these chin tucks. You may feel a stretch at the back of the neck. You may feel muscles working in the front of the throat here. Let's do 1 more. Beautiful. Really aligning the head over the heart. And the next exercise will be working between the shoulder blades. So pinching and squeezing the shoulder blades straight back together. We'll pause and then release. Don't worry about the forwards part. And if it helps to go kind of up, back, and down, that's also great. So either up, back, and down, or straight back, or back and down. Whatever really allows you to breathe in and breathe out. 3 seconds on, 3 seconds off. We'll do 2 more. And the arms just go for the ride here. So the arms aren't leading the charge. It's more of the shoulder blade muscles pinching straight back together and then releasing. And we'll do 1 more and rest. Really helpful to do these in the morning when you're making your coffee or tea, standing up against the wall. It can feel so different from our normal standing posture to actually align to that straight line. The chin tucks can be done anytime, even in the car with your head against the headrest. And the shoulder blade squeezes can be done in between your work meetings or when you're waiting online at the grocery store. It's all about sprinkling in some of these activities into your daily life. More specific exercises for the jaw might be prescribed by your physical therapist. I like to go through these with some of my patients because they really help work on the breathing. So the first of these 3 exercises for the jaw specifically is to put the tongue at the roof of the mouth. Keep the contact, keep your mouth closed, breathe in, breathe out. 1 more. So in this instance, 6 seconds, 6 times, because this is a group of 6 different exercises. There is the tendency to really want to kind of keep the jaw closed, but here would be the tongue at the roof of the mouth, keeping that space between the jaw with your breathing. And if you're not able to breathe in through your nose or out through your nose, you can always open your mouth slightly, but practicing this. The next one is putting the tongue at the roof of your mouth and then opening your jaw for 3 seconds or 6 seconds. Tongue at the roof. And demonstrating this can look pretty silly, but doing it in front of the mirror and working on that tongue at the roof of the mouth and opening can be really helpful. Finally, the third of these 3 jaw-specific exercises is to put your fist, or even a towel for a little bit of softness, at the bottom of your mouth. And we're gonna do that same tongue at the roof of the mouth and open, but this time resisting. Rest. Think of 50% of your pressure, or 60%. We're not going for gold here, just to activate and turn on some of these muscles at the bottom of the throat. Combine these with the shoulder blade squeezes and the chin tucks. The 6th exercise is to place your hands behind your head and then to draw your head forward, stretching the muscles in the back of the neck. 6, 5, 4, 3, 2, 1. Inhale, back up nice and tall, and repeat 6 times. This is a beautiful stretch for the shoulders as well as for the neck as well. Rockabado's 6x6 exercises for TMJ dysfunction. And you can see a link to that in the presentation slides. Finishing up with the home program, alluding to self-massage. This is great to do in the shower. You can work on intraoral massage, working inside some of those muscles. Your physical therapist can show you some of these techniques. And even using a clean gloved hand is really helpful. So I have a patient, she is a busy mom, and for her, it works really well to do these exercises when she's getting in the shower. She'll get in the bath, she'll turn the hot water on, and while the water's heating up, she'll stand with her back up against the wall and start to take some deep breaths. As the hot water heats up, she'll get into the shower and practice some of the chin tucks and the shoulder blade squeezes as that hot water is beating on her neck and shoulders. She'll do a little bit of intraoral massage after she's washed her hands, and even a little bit of self-jaw distraction, which your PT can help you to learn about. And then when she gets out of the shower, she wipes off the mirror and does some of her jaw-specific exercises. So it's all about working these things into your day-to-day routine. Remember that case study I talked about at the beginning with Dr. Andrew Henry? We're happy to report after 5 sessions, this patient is now able to eat sushi. She's in the midst of recording an EP of 6 different songs and working on her breathing while singing, her posture while sitting at the computer, and some of the jaw-specific exercises have made a world of difference for how she's able to move her head, her neck, her jaw, and she feels more confident. Next goal is to be able to eat a burger, and I look forward to that day. Thank you so much for participating in this discussion on jaw pain, teeth grinding, and TMJ disorder, and how physical therapy can help you. Ask your dentist, ask your doctor, or look up your local physical therapist. I'm here at Union Square Physical Therapy in Somerville, Massachusetts. You can check out unionsquarept.com or send me an email at info@unionsquarept.com. I'm also on social at Union Square PT and always happy to chat. I look forward to seeing you in the next discussion.